Osteoarthritis is a degenerative joint disease that occurs when protective tissues and cartilage near the ends of bones break down where a joint may lose its initial shape, causing chronic pain over time. Introduction to osteoarthritis. Disease of a whole joint causing pathological changes to musculoskeletal tissues, including cartilage, bone, ligaments, fat pads, and synovial joints, which are the lining of the joint. It is possible to occur in any joint of the body, but it is most commonly seen affecting areas of the neck, knees, hips, lower back, and hands. Components of osteoarthritis. Aging. The risk of osteoarthritis increases as a person ages, and as more symptoms are experienced in individuals over 70 years old. Family history and genetics. Some individuals are born with osteoarthritis and are likely to develop osteoarthritis if it is present in family history. For example, bone deformities, malformed joints, and defective cartilage. Overweight individuals, osteoarthritis is more likely to be seen in these individuals due to stress on joints such as knees and hips. Fat tissue produces proteins that can cause harmful inflammation in and around joints. Sports can cause risk of osteoarthritis as well due to direct impact on specific joints. This has also been seen with injuries that have healed years ago and can cause osteoarthritis later in the future. Jobs that require lifting, squatting, kneeling, and stress on the joints over time can increase the risk of osteoarthritis as well. Metabolic diseases. These diseases include diabetes and hemochromatosis, is when your body has too much iron. Signs and symptoms of osteoarthritis and how osteoarthritis affects the body. It can be affected by inflammation, joint pain, stiffness, whether it's waking up in the morning or when taking a nap. You have weakness of your muscles, loss of balance, and clicking and popping when a joint is moving around. Although there is no blood test for osteoarthritis, blood tests can rule out rheumatoid arthritis. Joint fluid analysis is when a needle is used to draw fluid from affected joint. It is tested for inflammation to rule out other causes of pain in joint. X-rays are used, and X-rays can show a cartilage loss as shown by the in-between spaces of the bone and can show bone spurs. MRIs are also used because it produces a detailed image of both tissue and bone as well as cartilage and can also provide better understanding of an affected joint. Treatment methods of osteoarthritis include acetaminophen, which is shown to help with moderate to mild pain, a non-steroidal and anti-inflammatory, which is taken at recommended dosages. That includes ibuprofen, Advil, and Motrin. If needed, stronger non-steroidal anti-inflammatory, it can be available by individual prescription. Physical therapy strengthens muscles around the affected joint to reduce pain and increases flexibility in affected joint. This could be either walking, jogging, biking. For those who are overweight, swimming might be more effective in pain management rather than walking or running. Occupational therapy could be having a bench in the shower rather than standing. Cortisone injections are injections into the affected joints that could possibly and may relieve pain for a few weeks. Usually limited to 3 to 4 times a year. It's due to the medication causing potential damage to joint over time, that it's only 3 to 4 times a year that a person may receive these injections. And lastly is joint replacement, is when surgery where damaged joint surface is removed and is replaced with metal and plastic parts. They may need to eventually be replaced if an artificial joint comes loose and or wears over time. Living with osteoarthritis. Adapt and adjust. Keep doing the things you love, whether that's walking, jogging, gardening, walking your dog. Keep doing the things that you love, and that will continue to help you with pain management.